Move into next Wednesday when the current lockdown ends. Around 23 million people have learned that they'll be living under the toughest level of restrictions. That's tier 3, which compares to just over 8.5 million in the same tier pre-lockdown 2.
Tier 3 cities include the likes of Birmingham, Leeds, Sheffield, Manchester and Bristol. In those places and anywhere else in tier 3, pubs will only be able to offer takeaways. Households.
You still with us, Doctor?
I am.
Except in outdoor public spaces like parks and beaches.
Perfect. Your video has just frozen slightly, but I think you're back with us now. It's all good. It's all good.
Well, in the last hour, during his Downing Street briefing, Boris Johnson outlined why he felt there was a need for a tighter tier system.
If we ease off now, we risk losing control of this virus all over again, casting aside our hard-won gains and forcing us back into a New Year national lockdown with all the damage that would mean. The tough measures in our winter plan are the best way to avoid this outcome. All our friends around the world are grappling with the same question of how to keep people safe without retreating into a winter of hibernation.
Well, across other areas of England, London will go back into tier 2 along with Dorset and Devon. The Liverpool City region and Warrington, which were in tier 3 before the national lockdown, will also be in the middle tier of restrictions following a mass testing campaign. The Prime Minister said this was an example of what can be achieved.
This is a success story which we want other parts of the country to replicate. So we'll work with local government, with public health leaders and our fantastic armed forces to offer community testing to tier 3 areas as quickly as possible, opening the way for them to follow Liverpool's example.
Well, at the beginning of November, more than half the country was in tier 1, meaning that households could mix indoors with the rule of 6. This time around, that will only be possible in Cornwall, the Isle of Wight and the Isles of Scilly.
Well, despite the new system's stricter rules for hospitality venues, gyms and beauty services like hairdressers will be able to reopen in all tiers. And people across the country should continue to work from home if they can. That's the message. The new tier system will be reviewed regularly. The first review date is scheduled for the 16th of December.
Let's get some reaction then. Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter Medical School. Good evening. Welcome to the programme.
Hello, good evening.
The tiers are slightly different to the ones that we knew from before the lockdown, and also the areas that are in those tiers are broadly different as well. Do you feel that this is a good system that the government have put in place now?
It could be better. So, for example, Manchester in tier 3, Liverpool in tier 2. Manchester and Liverpool are not far away. So whatever happens in Manchester can percolate down to Liverpool and the other way around. So we need to be aware. And similarly here in Bath and Bristol. Bristol is in tier 3, Bath is in tier 2. Of course, we expect that infections can come from the higher tiers to the lower tiers. So we need to be aware of it and create a bigger fire break area rather than a patchwork quilt.
That's interesting. What about the concept of bringing in mass testing to different areas on a scale that we've seen it in Liverpool, which seems to have been successful?
Yes, I heard Prime Minister Johnson say what a success it was in Liverpool, and I beg to differ, because we can have a pulse of infection go through a city, and then it will come, the case numbers will go up, and then the case numbers go down with restrictions and social distancing and public health messages and all that. And you cannot claim that it is my testing that achieved it, because with testing, you need contact tracing. And if you haven't done testing and contact tracing properly, you're claiming credit for something that you shouldn't be claiming credit for. Furthermore, in Liverpool, when you tested, I don't think you effectively tested. What you were doing was a screening exercise, which is something totally different.
There was an interesting detail, I thought, in the press conference as well, when the questions were being asked about Christmas and the fact that 3 households, and this is across the UK, 3 households can meet together to travel across nations, tier areas if they need to spend those 5 days together. Now, and it just goes to show, you know, even though Tony and I talk about the restrictions every day, you can't know every bit of them. I was under the impression that we were already told that when you bubbled with other households at Christmas, that you were supposed to try and limit physical contact. But there was this discussion in the press conference about avoiding hugging and kissing. I thought that was clear already, or am I wrong?
Well, it is clear, but when you are already in the household, you're going to be sitting at the dinner table, you're going to be watching television together, you're going to be having drinks together. So it's not the hug that is going to prevent the infection. It is the being in close proximity, if you happen to be infected and infectious, that will spread the infection. And to sort of say, it's all okay, but don't hug and you won't pass on the infection is not actual true science. And when Prime Minister Johnson was saying that we need to have these measures, otherwise we will undo all the hard work, I counter it by saying relaxing all the restrictions over 23rd of December for 5 days will undo quite a lot of the hard work as well.
When you assess where we are at the moment overall, the vaccines that are hopefully around the corner, looking at the rate of infection, do you feel positive, or are you still concerned with the way things are looking?
No, I do feel very positive. I feel the mRNA vaccines plus the vector vaccine from AstraZeneca Oxford Group plus others are on the cusp of being licensed. And therefore, I feel, look, we've endured a lot of difficulties in 2020. Just hang on in there for a little bit longer. And once the vaccines are fully deployed, we can sort of say, now ease the restrictions. So I am feeling positive. All I'm asking our people to do is endure the difficulties a little longer until the vaccines are deployed.
Doctor, thank you. Dr. Bharat Pankhania, who's a senior clinical lecturer at the University of Exeter Medical School.
Yes, it is 6:15. We're going to talk more swimming after 5:30. There are 3 games in Europe.
Dr. Bharat, thank you so much for your time this evening. That was great.
Pleasure. Thank you.
Thank you so much. Enjoy the rest of your night.
How to put the 6 o'clock news off and put